Cancer Guidance by Type, Part 23. Dr. Dilip Gadgil, Pune. Bladder cancer. I spoke about prostate cancer yesterday. Another important type of cancer is that of the urinary bladder. In this type, the patient's urination becomes painful and sometimes there is blood discharge through the urine. Certain tests are done to diagnose bladder cancer. Cystoscopy is done by using a hollow tube, cystoscope, equipped with a lens in the urinary bladder. If cancer cells are found there, a biopsy is done. There are two types under this: 1, muscle invasive, which goes through the bladder muscle, and 2, local, which is right there. If it is local, a turbed treatment is done to destroy it. But it generally tends to recur and the same kind of treatment is given each time. Let me share an experience related to this. A cloth salesman, who worked in an air-conditioned shop, used to serve the everyday traffic of customers with tea, coffee, and soft drinks. Since the footfall was good, he couldn't take too many loo breaks even if he felt like going. Given this routine for several years, he got used to blocking his urge to urinate. This eventually led to bladder cancer. After cystoscopy and biopsy, it was declared that it was muscle invasive. The thing is that the cancer is not restricted to the bladder and could spread to the stomach or other parts of the body. Today's doctors suggest removing the bladder. He came to me for consultation and asked me if getting the bladder removed was a safe and good choice. I asked him for 3 months of time. I said I don't mind trying something if, despite knowing that it could increase or spread, you are ready. He was ready to take that risk and we started the treatment. In Ayurveda, we have a treatment method called Attabasti. We gave him medicines via the stomach and kept him on a milk diet. After 3 months, when a cystoscopy was done again, it was realized that this was local. This was a huge victory for us and the patient. We continued the medication and cancelled the surgery. After a year, there was a local recurrence. TURBT was done, and again after a year, a similar procedure had to be done. It's been 20 years to this now, and he has never had another problem after that. This is an interesting and important case from a treatment point of view.